Most important thing is no breakfast for your dog on the day of surgery. Things to bring with you when you drop off your pet. Oh my God, why is half my dog bald when he's only got this 3-inch incision? Different dogs handle anesthesia differently.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Are you scared about your dog's surgery? We know exactly how you feel. Stay tuned for behind-the-scenes key steps to take to help your dog sail through the day. Hello, I'm Molly Jacobson, Editor-in-Chief over at dogcancer.com. We're over 40 veterinarians, veterinary oncologists, veterinary technicians, and cancer researchers and science writers like me pull together to bring you better information about dog cancer so you have no regrets tomorrow. This is the second of our 3-part series on dog surgery. The first show was about the things you can do in the days or week ahead of time to prepare for surgery. In today's show, we're going to go over the things you can do on the day of surgery to help manage you and your dog. And in the next and final show, we'll talk about how to care for your dog in the days and weeks after surgery. To give you the behind-the-scenes expert advice that I know you're looking for, we're bringing back Kate Basedow, a licensed veterinary technician. Kate has fabulous insights and really great tips on how to help you and your dog get through the day with confidence. Which reminds me, if you do find this content helpful, please help us help future dog lovers. These videos live for a long time on YouTube, so if you like and subscribe and leave a comment with your own question or your own tip, it can really help the algorithm help future dog lovers looking for the same kind of advice. So please like, subscribe, and leave a comment. And now to Kate Basedow in her conversation with James Jacobson, host of Dog Podcast Network.
Today we are focusing on what to do on the day of surgery to ensure the best outcome. And joining us once again is our associate producer and licensed veterinary technician, Kate Basedow. Kate, thanks for being with us.
You're very welcome. Happy to be here.
On the first episode, the last episode, we talked about what to do before you are going into surgery. But this one is about the day of. So what do you do? It's the morning. What happens?
Most important thing is no breakfast for your dog on the day of surgery. It's really
breakfast.
hard. Yeah, I mean, you've got those puppy dog eyes, and with my dogs, I usually just don't feed anyone, because if I fed one dog, the other one would be like, "What is this?" and throw a fit. So no one gets
good.
breakfast on the
Be
day.
mean to all of your pets.
Yep, we all suffer together. And
If
then
Clarence has to go in for surgery, no one's getting it.
Exactly.
At least until we leave in the car. That's good advice.
Yep. And show up on time. If your veterinary team asked you to drop off between 8 and 8:30, plan on being there between 8 and 8:30. Sometimes you're able to get your surgery admission paperwork ahead of time, and so you can review that at home and have it all filled out and ready to go. If you're going to need to fill out paperwork on the day of the procedure, plan some time for that. Surgery drop-offs are not as quick as if you're doing a drop-off appointment for something basic like vaccines or just checking out an ear infection. Their anesthesia, modern anesthesia, is very safe for the most part, but there are still a lot of risks and things that you need to be aware of, and that legally the veterinary team needs to be sure that you're aware of. A lot of times that paperwork will also include things like any vaccines that they require your dog to be current on. There's also usually a note on fleas, because a vet hospital infested by fleas is a really bad time for everyone. Other things that'll be on that paperwork is a DNR form, do not resuscitate, where you can say whether or not you want your dog to undergo CPR if they do go into cardiac arrest during the procedure. You can ask the veterinary technician or the veterinarian, whoever's doing the admission, how their usual surgery day routine is. Some clinics stagger appointments with surgeries. Other places lump surgical procedures. If you're going to a specialty clinic, most likely all that the surgeon is doing that day is surgeries. It just gives you peace of mind so that you know when to expect the call that your dog is done. So things to bring with you when you drop off your pet are any medications that he's on. This is both so that you for sure are telling your veterinarian everything that your dog is on, which is especially important if you've been seeing multiple specialists or got a second opinion somewhere and might have medications from multiple different vet clinics, or if your dog is getting surgery at a specialty clinic and they may or may not have already gotten the records from your regular vet. Should have, but things happen. Also bring with you your dog's cone or bodysuit so that it can be put on them right after the surgery to protect the incision, because once you've paid all that money for a surgery, you don't want your dog to rip open the incision and ruin it. And also bring with you a copy of your records and any blood work, especially if you have been seeing multiple vets, just to be absolutely sure that the surgeon has all the most up-to-date information. It used to always be paper-based, but more and more hospitals are starting to use email, and they'll fax records between hospitals, but usually giving it to owners, it'll either be a printout or they might send you an email.
And when you ask for records, it's not just the veterinary notes, but also copies of or electronic copies of X-rays and other things that they've done, so that can be helpful for the surgeon as well.
Yep, you want all those goodies. And if blood work has been done recently or X-rays have been done recently at a different hospital, giving the surgeon that information means that they won't have to repeat those things that day. When your dog goes in and is put under anesthesia, the technician will shave the area around the incision. And this shaved area could be quite large. And you might look and be like, oh my God, why is half my dog bald when he's only got this 3-inch incision? And that is so that we can have a sterile field to work on, because hair can trap bacteria and dirt and debris and everything, all kinds of things that you don't want inside your dog's incision or inside their body. It'll grow back, might take a little while depending on the area. Sometimes the first time the hair grows back, the texture might be a little different or the color might be a little different, but usually the next time your dog goes through a shed cycle, it'll all go back to normal.
And don't worry, the other dogs won't make fun of him.
The other spot to expect to be shaved is on your dog's front leg where the catheter will be placed. And that, again, is for sterility, because the technician or the veterinarian is going to be placing a catheter into your dog's vein. So a common question that we'll get from some owners is, why can't I come in with my dog and stay with her until she's under and goes in the OR? There's two big reasons that can't be accommodated. One is safety, and the other is privacy. For safety, it's a hospital. There are needles, there are sharp tools, there are drugs, some of which are controlled substances, and it is not safe for someone who's not trained to be hanging out in the vet hospital as everyone's trying to get their work done. And on privacy, it's the privacy of other pets and owners. Some people are very stressed about their dog's medical problems and don't really want a ton of strangers looking at their pet not feeling good or watching their pet's surgery. So try to keep everything private and safe for everybody. Things to expect for the end of the day. Either the surgeon or the technician will go over the discharge instructions with you. So they'll go over exactly what happened, any medications that your dog needs to be on. If you've opted to send out a histopathology sample, so sending out either a biopsy, chunk of the tumor, or the entire tumor to the lab to be analyzed, they'll go over that with you and let you know when to expect results back. Always make sure that they give you a written copy of all of that, because no matter how well we think we're paying attention, your dog just had surgery. You're stressed,
Right.
You're relieved that they made it through the procedure fine. You're not really paying attention, and you're going to forget things. You're going to get home and get your dog out of the car and go, wait a minute, when am I supposed to give these medications? So always Most vet clinics will just automatically give you a written copy of the discharge instructions, but always ask for a written copy if you aren't handed one, so that you have all the information laid out and know which medications need to be given when, how long your dog needs to be on leash walks only or restricted activity, and when to expect different things to happen through the recovery process.
What are some of the things that, if you've never had a dog under anesthesia, that you can look forward to when you see your dog?
Yep. Different dogs handle anesthesia differently. Certainly, usually young, healthy dogs go through anesthesia no problem. Some dogs after a spay or neuter are bouncing out the door, ready to go play. It's like nothing happened. Trying to keep those quiet through the healing period is a nightmare. But older dogs or dogs with a lot of health problems, they're usually not feeling too great afterward. I mean, they just had anesthesia and a big surgery, so of course they're not going to feel their best. They'll often be a little groggy. They may stumble. And once you get them home, they're probably going to take a nice bit long nap. Some of them hold a grudge. My oldest dog, when she got spayed, she was 13 years old, which is kind of a long roundabout story, but she was not happy with us. And she was cranky for a good 3 to 4 days. And then she decided that maybe she could forgive us.
So really it's dependent on the dog and I guess the dog's disposition. But if you think your dog might be that way, just go in aware, because that seems to be an important thing versus being shocked. Like, is this not the dog that I dropped off? Kate Basedow, thank you so much for being with us. And thank you for joining us today for Dog Cancer Answers.
Check the video description for links you don't want to miss. And in the meantime, we really hope that Kate's advice and insights will help you stay calm and your dog sail through their big day. Don't forget to like and subscribe, leave a comment with your own ideas and suggestions and stories, and I'll see you over on dogcancer.com, where we bring you better information today so you have no regrets tomorrow about the way you handled your dog's cancer. Thanks for watching, and I'll see you soon.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.